this parallel session of You for Health Nutrition Live. This parallel session is about policy, so we'll try to focus and dig into what has been already said before and try to avoid duplicating. But first of all, we thought it would be nice to hear the voice of patients. So Michal Rataj is representing the European Patient Forum, so he will tell us more about the organization and also their views on the topic of nutrition and how they see the future developing in this field.
Thank you. Garel, good afternoon, everyone. My name is Michal Rataj, as it was mentioned. I am the board member of European Patient Forum. Firstly, I would like to thank to the European Nutrition Health Alliance and hosting MEP Tarabella. Unfortunately, as I heard that he is not available now, for organizing this important event and for inviting EPF to share the patient view on this debate, which is what is very important. Briefly, because probably most of you doesn't know what EPF exactly is. EPF is, you are not familiar with it, so European Patient Forum is a membership-based non-governmental European organization. EPF aims is to be collective, influential patient voice in European health and related policy, a driving force to advance patient empowerment and equitable patient access to care in Europe. We represent people with chronic and long-term conditions, and our 75 members include European Union Chronic Diseases Specific Organization and National Coalition of Patients. Since 2012, EPF is committed to collaborative activities to raise awareness on the link between nutrition and effective integrated care continuum for patients. Back to today's topic, we all know that links between nutrition and health have been known from ancient times. A French lawyer and politician, Jean-William Savarin, said, "Tell me what you eat and I will tell you what you are." And I think these words are still up to date today. We all know that the word malnutrition, it's in broadest sense, means for poor nutrition and encompasses both undernutrition and overnutrition. Less well known is that important role that nutrition plays in chronic disease management. Some medical conditions mean that even when a person makes good nutritional and lifestyle choices, achieving good nutrition health remains very challenging. Diseases-related malnutrition is undernutrition triggered by ill health. It is estimated to affect 1 of 4 adult hospital patients and 1 of 3 home care residents. To determine the risk of malnutrition among patients at all levels of care, screening of malnutrition is a key. Similarly, we believe that there are also efforts to be made in training and awareness of health professionals on this subject. And when it comes to nutrition in the policy context, nutrition is a priority, or it should be the priority, for many governments and international institutions. Most member states have government-approved policies to aim to improve healthy diets, tackle the growing rates of obesity, and ensure nutrition and food security. The European Union is also taking the area of nutrition from different angles. For example, in the context of its recently published Farm to Fork strategy, the Commission will propose harmonized mandatory front-of-pack nutrition labeling to empower consumers to make informed, healthy and sustainable food choices. The strategy states that the Commission We'll also explore new way to provide information to consumers through other means, including digital, to improve the accessibility of food information. EPF, European Patient Forum, is very supportive of this initiative. Several of our members have developed recommended measures to future improve the European Union regulation on the provision of food information to consumers, including on front of pack labeling. Information and awareness are essential to improving public health and patient quality of life. Furthermore, being health literate empowers patients to understand information about health and make informed decisions. It's therefore important that nutrition-related research, guidelines, recommendations, and good practices reach patients. Patients' organizations, healthcare professionals, governments, and the wider education system all have their specific role. I can risk even the opinion that they have a fundamental role to play in this area. If I may, to share with you also some EPF recommendations on the topic of nutrition. For EPF, there are four elements that are crucial to advancing European nutrition and health policy. Firstly, nutrition screening should be included in diseases management programs, and nutrition counseling should be available and integrated in all hospitals. Secondly, access to appropriate, affordable, and timely nutrition care should be guaranteed to all patients. Patients can face issues to access to the appropriate nutrition if reimbursement is not available. For example, reimbursement for medical nutrition is fragmented in Europe, where reimbursement is decided at country or even at regional level. Even at country, regional level, reimbursement remains partial and diverse, and can depend on the care settings, hospital community, on the indicators cancer, stroke, on the patient's age, on the dosage recommended by the healthcare professionals, and etc. This limits access to appropriate nutrition care for patients. EPF recalls Article 35 of the European Union Charter of Fundamental Rights and recommended that European Union should support patients' access to nutrition appropriate to their condition as a part of fundamental right of patients, healthcare to the medical treatment. Understandable information should be accessible to all patients to empower them to make informed decisions about their health. And last but not least, patient and their organization should be meaningfully involved in area of policy that affect them. No other stakeholders is as informed good about patients' needs and priorities as patients' organizations are. Based on patients' experience, have very valuable insight into how policy can be improved or better applied. Whether it's about clear labeling and better consumer protection on food that fits the needs of patients with specific conditions, nutrition affected both the health and quality life of patients. Therefore, patients' needs and perspective needs to be considered. Furthermore, the ways in which nutrition affects certain disease areas is very often still unknown, and even when it is, limited attention is drawn into. Patient organizations have an equally important role in advancing for future research and involvement of patients such researches. And on the end, the critical role of nutrition in improving quality of care has been shown. However, as in all areas, continuous research is very important for development and improvement of policies and legislation. And I think it's, on the beginning, it's all from my side. Thank you for giving me time and to present some words from the patient perspective. Thank you.
Thanks a lot, Michal, for this very good overview. You have been brilliantly setting the scene from the perception of patients. I will now turn on different points you mentioned to Laurence and Olle. And the first element I want to pick is about screening policy. That's the first items you presented to us. I would like to hear more about how Belgium is trying to handle the screening issue, and also how, and to Laurence and to Olle, how the Nutrition for Health Alliance has also included this approach of promoting the screening at all levels of the health and social system. Laurence?
Okay, thank you, Michal. That was very interesting intervention. I wrote some key elements that you have presented, but I will first answer to you, Pascal, concerning the screening. Since we have this undernutrition issue set in our nutrition and health plan strategy, we have, of course, set recommendation concerning the screening tools, which is the base of the diagnosis of undernutrition, of course, for the different settings in hospital, in care home, and in home care, since ages. In fact, we have done this job in about 10 years ago, more. And we have developed also a nutritional quality standard charter in care homes, which is very important within, of course, the screening of each patient in care homes. This is very important that every admission in hospital, in care homes, and also in home care, but it is more difficult because it's up to the general practitioner, the first line of care. But anyway, for the first two settings, it's very crucial that we have a good screening tools, and it is not the same for all, but we have making a distinction on it. But the most important thing is not only about screening, it's also about management of the undernutrition, because this is the very beginning to know that someone is at risk, but what you do with these people. So this is of course our main concern, and of course we have also gap on this management between hospital, since people are leaving the hospital because we have short duration of staying. Yeah. This is also important to mention. So we need a good management after they go back to home or to care homes. I would like to say that at also community level in Belgium, Wallonia has done a very good job to implement into regulation this nutritional charter that we have in care homes. In fact, if you want an agreement, you need to adhere to this charter. So this is very important, and they have developed a pilot project to better address the problem of undernutrition at home with a good management of undernutrition in home cares. So this is very important to give the chance to all people to live in a good state, and there is many aspects to taking into account. Maybe
so screening, management. So yes. It's possible. It's done in Belgium. It's even done at regional level, even stronger. We'll come back.
I will just mention, maybe Olle will mention it, but there is the Nutrition Day.
That's what I wanted to mention.
So and we participate, many hospitals, to count how many people are at risk in hospital. It is in November, so we are in a good period of time.
We're very close to it. And Olle, yes, this is good practice here in Belgium. We know it's not the case everywhere. Screening is far from being, the rule. And there's this nutrition day, but it's one day a year. So could you tell me more about what's happening in the Alliance to try to push for screening? Of course, management should follow. It's not screening in itself, but at least starting by this.
Yeah, absolutely. I think what we've been trying to do over the years is really to find where things are working, find out why they're working, and then try to use that knowledge and then move it to other places. And we have to realize that things look different in different countries. We have different healthcare systems, different care systems, and different payment systems. And a lot of things are different, but the commonality is that we're facing the same problem. So it's about finding what are the key issues. First is awareness. This is a problem, so that's very key.
Exactly.
And then, of course, you realize here's a problem. How do we find it? That's where the screening comes in. And then, of course, you need to do the training. And it's about taking care of all the different initiatives that are out there. And we have a number of organizations that are involved in the ENA charity. So Nutrition Day, that's an ESPEN issue, which is, the multi-professional clinical nutrition group that has brought this forward. And it's actually not just in Europe, it's worldwide. And it's a huge way to bring forward data. What is actually happening in the hospitals, but also in care homes and in intensive care. So it is broadening up. But we also have other initiatives from, let's say, the dietitians are doing other things that among them and bring them forward, and it's about making use of all of them. So really what we're trying to do is to create that platform. And I think it starts with awareness, and I think that's really where we need to start. And it's interesting to hear Michal talk about, his point of view from the patient's point of view, and I think that they have done a fantastic job in actually engaging the patients, the patient organizations, to help present ways of reaching the other patients because they know what is needed there. And this is typically the way that we're trying to get everybody to work together. Who knows this best? You know how to speak to government, so we want to have you on board to do that. And then, of course, the patients speak to patients, but we all meet. That's sort of the key.
Yeah. To follow on this, let me follow on a question that was raised on the chat, and please feel free to communicate any question you have. We have Teresa Rodriguez of Ministry of Health. We don't know which country. I'd like to ask your opinion about using nutrient profile systems in health policies, more specifically in improving healthier food availability. That's also related to a point Michal mentioned about information. Do you have views on this? Laurence, please.
No, you go ahead.
It's okay. It's typically my job, so
yes.
Nutrient profiling system. It's a big issue too at the EC level since I was starting my job. So and we are still discussing on it. So not easy task, but I think European Commission is working on it to develop better front of pack labeling dedicated on nutrition quality of food. Michal spoke about the FOP, so this is front of pack labeling, and information to consumer need to be improved because people are not knowing enough what they are going to eat. So this is very important that we develop evidence-based, scientifically good system to better inform the consumer. But nutrient profile system in healthcare policy, in health policy, it is at the debate for the moment. In the farm to fork policy also. Normally in 2018, 22, European Commission should decide for a FOB system. So they will implement at EU level, they will recommend a FOB system for all the member states. And it was one of the points of Michal. So I think it's a very important question also.
Awesome. So yes, we move to consumer, we move to citizens, families, and of course patients on that issue. There was something more specific mentioned by Michal, which was the patient involvement, so meaningful patient involvement. Does it ring a bell in your policy in Belgium, in the examples we found around Europe? How could we give some good example of this in our work in the European Nutrition for Health Alliance at Belgian level?
Yeah, I think we have since several years back now. I think we have been meeting with the key patient organizations, and just the mere fact that we are sitting down and talking to each other, for me it was a big eye opener. I must say, I see patients a lot. I've seen them for years, but I've been seeing them from my perspective. And it's only when you sit down and you talk about and listen to what they're talking about among themselves, especially when it came to nutrition. I think we were speaking, past each other initially, but by joining forces, by sitting down and looking at what we're talking about together, we have found a common agenda. And there are many things that are happening. One is that, of course, we write guidelines for the professionals. These guidelines should and are now being made available for the patients as well. So it's all written in lay language, so people can understand it and can follow it and can see what kind of care they should be given when it's presented by the experts via the patient organization. So that's a very good example, I think, of how we can help each other to communicate the important things to the ones that really need it.
I can just add that, of course, the patient consideration and they input are very, very important to implement good policies. And in the future, I think their role will be emphasized for sure, because we are speaking now about personalized nutrition, personalized care also with a new premature newborn. We have seen that the implication of the parents in this NICU unit going up. I mean, we ask the parents to have also the right to say their opinion.
Shared decision
and
making.
maybe you see in your daily practical that the involvement of the patient is going up, because of course they know their knowledge is going up too, sometimes not so good because internet has not all good side, but anyway they are demanding a lot to be involved, better involved into the consideration. And you have also this new regulation at EP level that when you got 1 million of signature, you can count in the decision. So I think the patient association has a very key role to play.
Yeah, let me follow up on that, because in my practice I'm a surgeon, and obviously the patient is really the only one who's making the journey through care, and they meet a lot of different people, and each one of us is very busy taking care of our own part of that journey, and we focus on that. We don't really know that well what is happening in the next station, because we don't have time with that. We have the next patient to take care of, right? So we have a difficulty in our own world to realize what is the entire care pathway. Very few actually have a full control over that. And that's in the hospital for surgical patients. Now you can just imagine how difficult it becomes when you have somebody in home care who's going to the GP, who's then going to a specialist, and maybe to the hospital, and then back to some rehab, and then back. It becomes very complex, and we need to know the entire journey. And I think that this is something where we need to look more closely into that and see how we can engage the patients in helping us develop these pathways in a way that is suitable for them, but at the same time take care of the professional, let's say, insights and knowledge, so that we do the right things at the right moment and not make things difficult for the next caregiver, if you like, and for the patient, obviously.
A third item coming also from Michal, and I will come back to you, Michal, after this. It's a difficult point of access, and you mentioned the word affordable, and that's also a key issue when you're talking about healthcare. Olle said we have different healthcare system organization, but also funding in the systems, reimbursement mechanism, etc. So. Any views on what Belgium has been able to do in this? Olle, did you experience also some good practices in terms of providing more affordability in this field of nutrition for patients mostly? Yeah.
I think that the fact that we have been from the professional and the research side of the group here, I think that there's been more and more data that has been provided for the decision makers to prove that actually it's very cost effective to use nutritional care as part of the plan. And you know, given the responsibilities of the decision makers, this is important. Whether we like it or not, they only have so much money to spend. So it's going to be our mission and our job to provide them with the information that helps them actually see what is the best thing. And of course, if you think of it, the most costly part of healthcare is complications, especially in surgery. That's the cost driver. So if you can avoid those complications, where actually nutrition is a very, very important part of all of this, you of course are going to save money. And at the same time, the whole purpose of our treatment is for the patient, and they will have less suffering. So I think the financial side of things and showing everybody that that's the way forward is the way. I don't know if you agree with
I think that Sweden and Belgium have a very good healthcare system. So we are a good example within Europe. And fortunately, we are not US. So we can count on very good social system. And but affordability, it's not only on cost of care, it's also affordability of good food that is important. Access to affordable care, but access in prevention. I mean, we should look at the affordability of nutritional quality of our food, what we eat, to not be sick, in fact. This is the preventing part, the most important also. But of course, affordability, it's important, and human resource is one point also that we have to mention, because in Belgium we have multidisciplinary teams in each hospital. We have support this cost for hospital, a team with a dietitian, geriatrician, gastroenterologist, all the person involved in the prevention of undernutrition. It costs money, but it's there is a good reward at the end, because first of all we screen the patient, and then we manage the problem of undernutrition. So at the end, as you have mentioned, it is a cost effectiveness action. And UK, for instance, has developed a lot of data on the dailies and qualis on undernutrition. We should mention them because they are very keen to show that there is cost effective measure in that field. Yeah,
no, they've done a fantastic job, and I think this goes in at very different levels. I mean, if we don't want to spend a little bit more money on, let's say, the food at schools for kids, we may have a problem. If we don't have the right food for people in care homes, same thing. But we also need to know that there are a lot of clinical situations where reimbursements for special treatment with nutritional oral nutritional supplements and things like this, that also has a very important place.
But it costs a lot.
It costs a lot.
It is not well reimbursed. So
I know that's a problem in many countries.
That's actually. That's a problem. Yeah.
Coming back to you, Michal, and actually with the question raised on the chat, how can we inform the patients about the skills and reliability of healthcare professionals in nutrition? Do you have any views on that?
I fully agree with the words before, that prevention is better than cure, always. But in regards to the question, I think that the better way to achieve some more relevant information is to cooperate, to be good cooperate. We need to build the structure. We need to build the good cooperation between the healthcare professionals and the patients' organization. For sure, it's one of the best way to achieving the best connection between all interested stakeholders. And so we need to sharing the best practices between all of us. So I think of course we have to do everything to reaching the common understanding. So it's my point of view. I don't know if it's full of answer on this question from the chatbot. I think it's all.
Can I ask Olle if he has some ideas about this skills and reliability of healthcare professional nutrition? A question asked by Jean-Charles Prezev of the Erasmus Hospital.
Yeah, I know. That's a good friend of mine, actually. And I think we both know that the skills and knowledge about the role of nutrition in general among our colleagues is not at the level where it should be. So I think we have a big job to do to actually make people in the professions aware of this, not only doctors, but also nurses. Mm-hmm. I think, anybody who's out there working with patients, there are a lot of people who have, at least in my country, who has limited overall training that is doing a lot of the home care of elderly. They should be trained as well, just to create the awareness. Mm-hmm. So I think we got a big job ahead to spread the information.
A final word, maybe the key element to bring back home for our audience.
Maybe
Laurence?
I can just add that we need, as Michal has mentioned, we need continuous research. We should invest in research because we need more data, as you have mentioned before. So European Commission should better address research in that field, I think. This is very important, key element.
Yeah, absolutely. And I think that the community, the professional community within ESPEN and other organizations, the geriatricians, etc., we have organizations and platforms that could help actually produce that research that is needed. There's a lot of research that just came out of the Nutrition Day, for example. So there's lots of information that we have learned a lot, actually.
And Michal, the last words are for you, from your side.
Thank you. From my side, last words, I will try to stress 3 points. More communication, more collaboration, and invest in health literacy. And then we will achieve something, what we need, I think.
Thank you, Michal. Thank you, Olle. Thank you, Laurence. We're closing now this webinar and we're back to the plenary.
Thank you.
Thank you.